Ebola, one of the deadliest diseases on Earth, has been declared a public emergency of international concern by the World Health Organization. What does that mean, and should we be worried about this disease? There are currently 3 known strains of Ebola that cause major outbreaks, including the Bundibugyo virus, which was detected on May 5th in the northeastern part of the Democratic Republic of the Congo and Uganda. But why is the current strain so concerning? The Ebola virus has an average 50% mortality rate, with the Bundibugyo strain's fatality rate ranging between 30% to 50%. There's already been 900 suspected cases and 220 deaths among them. To make matters worse, the lack of research on Ebola, the outbreak emerging in a remote region with limited resources, and a general poor health infrastructure in the region means the number of cases will likely grow. A local politician in DRC said that people have not been properly informed or educated about the severity of the disease, building deep distrust against the authorities. This has led to suspicion and even skepticism about the cause of deaths. Clashes erupted over the burial of an Ebola victim in an Ituri town at the epicenter of the outbreak, with protesters forcing their way into a hospital and setting medical tents on fire. People have also been demanding the bodies of their relatives so that they can carry out traditional funeral and mourning practices for their loved ones. Because of this, the virus has been spreading rapidly as corpses of Ebola victims are highly infectious. Ebola spreads between people through direct contact with bodily fluids such as blood, urine, saliva, sweat, and vomit. Symptoms, which usually take 2 to 21 days to appear, can include fevers, headaches, diarrhea, and even impaired kidney and liver functions, and internal and external bleeding. There is currently no vaccine for this Bundibugyo strain, and it could take up to 9 months for one to be ready. The Africa Centers for Disease Control and Prevention has also warned that 9 other countries could be at risk from an outbreak. Closer to home, Singapore has stepped up public health measures by placing advisories at all points of entry into and departure from Singapore for travellers. For now, countries outside the affected regions may not see Ebola as an immediate threat, but with cases continuing to rise each day, the epidemic could be outpacing us.